Hello everybody. Today I'll talk about the joints or articulations. First, we'll see the classification of joints. You know that the bones of your body are united together or joined together by the joints. And joints are the locations where two or more bones unite or meet or join. So we'll see the classification of joints. Then we'll talk about the most common type of joints called the synovial joints and the properties of synovial joints. Then we'll talk about different types of movements occur in the joints, and then we'll talk about few major synovial joints and their structures. First, as I mentioned, that joint or articulations are the sites or locations where two or more bones unite or meet together. And joints are the locations where we move our bones or body parts. So joints are for the movement of the bones or body parts. Okay. And joints hold the bones together in the skeleton. First, we'll see how we classify the joints of the body. We can classify the joints in two different ways. One is the functional classification. That means uh, how much movement occurs in the joint. By looking at that, the amount of movement, we classify the joints. Another way we classify is anatomically, by looking at the structure of the joints. So two types of classification: functional and structural. Functional classification includes three groups or types: synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis are the joints where no movement is possible. No movement occurs. Immovable joints are synarthrosis. Example, sutures. You know that cranial bones are attached to each other by the sutures, and those are immovable. You cannot move the bones. Amphiarthrosis are slightly movable. Small amount of movement is possible. For example, the ribs articulate with the sternum in the thoracic cage, and when you breathe, your ribs move slightly. So amphiarthrosis. Diarthrosis are the joints where plenty of movement, lot of movement occurs. For example, your shoulder joint, knee joint, ankle joint, elbow joint. So those are the diarthrosis. Structurally, by looking at the structure of the joints, we classify into three types: fibrous, cartilaginous, and synovial. Okay. Fibrous joints are the joints where the bones are held together by the fibrous, dense fibrous connective tissue. That's why they are called fibrous. Dense fibrous connective tissue hold the bones together. Okay. Cartilaginous. Cartilages attach the bones together. And synovial are the joints where the bones are not attached by particular structure. There is a cavity inside the joint. So inside the joint there is a space between the bones or cavity, and that cavity contains a fluid called the synovial fluid. So that's why a lot of movement is possible in the synovial joints. Plenty of movement occurs in the synovial joints because the bones are separated by a cavity called the synovial cavity that contains a lubricating fluid called the synovial fluid. Okay, so most freely movable joints are synovial joints. Now, fibers, there are three types: sutures or sutural, gymphosis or gymphosis is plural, and another type is syndesmosis. Okay, so those are three types of fibers: sutures, gymphosis, and syndesmosis. We'll talk about those three soon. Cartilaginous, two types. One is called synchondrosis, and another is called symphysis. So these are two types of cartilaginous: synchondrosis and symphysis. And there are 7 different types of synovial joints. Uh, so this is how we classify the joints. I'm quickly going over. We classify in 2 ways. One is functional classification based on the amount of movement: synarthrosis, no movement; amphiarthrosis, slight movement or small movement; and diarthrosis, lot of movement. Okay, and good example of synarthrosis: sutures, where the cranial bones are attached together and you know that cranial bones don't move. Amphiarthrosis, small amount of movement, as I mentioned, the ribs articulate with the sternum, and when you breathe the ribs move, small amount of movement. Diarthrosis, plenty of movement: shoulder joint, hip joint, knee joint, elbow joint, all those are diarthrosis. Now another way we classify is structural classification, by looking at the structures of the joints: fibrous, cartilaginous, and synovial. In fibrous, the bones are held together by dense connective tissue. Okay, fibers. And fibrous are 3 different types: sutures, gymphosis, syndesmosis. And then cartilaginous, the cartilage attaches the bones together. There are 2 types of cartilaginous: synchondrosis, symphysis. Okay, and synovial, there are 7 different types. Now we'll see these 3 types of fibrous and 2 types of cartilaginous. Okay, okay, here you see sutures. As I already mentioned, the cranial bones in the skull are attached to each other by the sutures. And if you see the joint, you will find very short connective tissue fibers like these hold the bones together. So inside the joint you will find very short interconnecting fibers. Okay, and the edges of the bones are interlocked. So like this is the edge of one cranial bone, for example your parietal bone. This is another parietal bone. So they are interlocked like this. Okay, so two parietal bones are connected, and you will find short, very short fibers. Okay, so that is suture. Immovable. Okay, so synarthrosis type joint. Now, another type of fibers is syndesmosis. And in syndesmosis, you'll see that the bones are connected by ligaments. And ligaments are bands of fibrous tissue. Okay, so you will find that the ligaments connect the bones together, and the movement varies. Some of the syndesmosis joints are immovable, some are slightly movable. Example, distal tibiofibular joint. Okay, so here you see this is tibia, this is fibula, and this is the distal part, and this is the ligament connecting the bones together. So this is an example of syndesmosis type joint. Okay, and gymphosis, another type of fibers. The teeth are attached to the bony sockets of your jaw bones by the periodontal ligament, and this is gymphosis. So your tooth articulates with the socket, bony socket of your jaw bones, maxilla and mandible by the periodontal ligaments here, and this is called a gymphosis type of fibrous joint. So those are three types of fibers. Okay, now I'll talk about two types of cartilaginous. You remember synchondrosis and symphysis. So synchondrosis are the joints where the bones are attached by hyaline cartilage. So if you see that the bones are connected by or attached by hyaline cartilage, that is synchondrosis. Symphysis, bones are connected by fibrocartilage. So if you see that fibrocartilage connects the bones, that is symphysis. Okay, so both are connected by cartilages, but synchondrosis by hyaline and symphysis by fibrocartilage. Okay, good example of synchondrosis is your first rib articulates with the sternum, manubrium of the sternum, that is by a hyaline cartilage. So that joint is a synchondrosis joint. Symphysis, intervertebral discs, the bodies of two vertebrae are connected by the fibrocartilage. So that is symphysis, intervertebral joint. Another is pubic symphysis. Two hip bones are connected by pubic symphysis, which is also a symphysis type joint. Its name is symphysis. Okay, so those are two types of cartilaginous. So here you see the examples of synchondrosis, hyaline cartilage. This is first rib, and this is the manubrium of the sternum. So that is a synchondrosis. Okay, and this is also hyaline cartilage. You remember when we learned about the ossification, the primary and secondary ossification centers join here, leaving a thin plate of cartilage, hyaline cartilage, so that will never be converted to bone. So that is a joint too, and that is called the epiphyseal plate. So this joint is also by hyaline cartilage, so it belongs to synchondrosis. Symphysis, as I mentioned, fibrocartilage in between the vertebrae, bodies of vertebrae, and so this is symphysis. and two hip bones are joined by this fibrocartilage here. So this is also a symphysis type joint called pubic symphysis. Now synovial joints. There are 7 different types of synovial joints. We will see the properties of a synovial joint. A typical synovial joint should have a number of things. So this is the end of a bone, okay, and this is the end of another bone, okay. So these are two bones, and in synovial joint you'll see the bones that form the joint. The end of the bone is covered by hyaline cartilage. So this is the covering hyaline cartilage here, okay. So the ends of the bones are covered by hyaline cartilage, and this cartilage is called articular cartilage, okay. What kind of cartilage? It is a hyaline cartilage, okay. Then you'll see the joint is covered by capsule. The joint is wrapped by or covered by capsule, and the capsule has two layers in it, okay. So this is the inner layer and this is the outer. So this is outer and this is inner layer of the capsule, okay. And outer layer is the fibrous. It is mainly responsible for protection. So fibrous, fibrous structure is tough, so outer fibrous, and inner is called synovial membrane. Synovial membrane, okay. So those are two layers of the capsule, okay. So capsule has two layers, outer fibrous, which is mainly for protection, and inner soft synovial membrane. And synovial membrane secretes the synovial fluid into the cavity between the bones. So you see, this is the cavity called the synovial cavity, and that contains what? Synovial fluid. Synovial fluid inside the cavity, and this fluid is secreted by the inner synovial membrane of the capsule, okay. And this fluid is a lubricating type fluid. It reduces the friction. Those are the structures you will find in typical large synovial joints. Some other structures are present in some synovial joints but not in all. For example, bursa. Bursa are fluid filled sacs, flattened fluid filled membranous sacs, flattened membranous sacs, okay. So bursa are present in large synovial joints but not in all synovial joints, so we won't include this as a part of a typical synovial joint. So this is what I just showed you in my drawing. So you will see all those structures here, ends of the bones covered by hyaline cartilage, articular cartilage, and two layers of the capsule, outer fibrous and inner synovial membrane. So these are two layers, and also the synovial cavity contains the synovial fluid. Okay. So if in your exam I ask you to draw and show the parts of a typical synovial joint, you will show those structures. Now bursa, as I mentioned, are flattened fibrous sacs, and they are filled with what? Fluid. So they are also filled with synovial fluid, and they act as ball bearing and reduces the friction and increase the mobility. So you know that for example, this is a bone and this is a ligament. Okay, so in between these two you will see flattened membranous sac, that is a bursa. So between the bone and ligament or tendon or muscle we have the skin, we have the bursa, and they act as ball bearing. So when you move the bone or move the muscle or ligament, the bursa will roll. So that will reduce the friction and increase the mobility. However, inflammation of bursa is called bursitis. So bursitis, itis is inflammation of bursa. If excessive movement occurs, or forceful movement occurs in particular joint for a long time, that can cause inflammation of the bursa, and that is clinically termed as bursitis, in which the movement will be painful or movement could be restricted or limited. Make sense? So here you see this is a ligament and this is the end of the bone. So in between this is the bursa. Okay. So this is a flattened membranous sac filled with fluid. Inside it you have the synovial fluid, and when you move the bone, the bursa will roll in between those structures to reduce the friction. Now we'll talk about the movement. You know that the bones move at the joints by the muscles. Skeletal muscles are attached to the bones, and by the contraction and relaxation of the skeletal muscles, we move the bones where? At the joints. So now this is a bone and this is another bone. Okay, and this is the joint. So here is the joint, and this is a muscle. So if you see the muscle, this end of this muscle attached to this bone, and this is the other end of this muscle attached to this bone. Okay, so two ends are attached to two bones, and this muscle is crossing this joint. Okay, so when this muscle will contract, what will happen? This bone will move towards this bone. So if that happens, if this bone moves towards this bone, this end of the muscle is called the origin. So the origin of the muscle is attached to the fixed bone, which is not moving, which is fixed. Which bone is moving in this case? This one, right? So this end of the muscle is called insertion. Insertion. So origin of the muscle is attached to the fixed bone, and the end that is attached to the movable bone, that is the insertion. So now we can say that insertion moves towards the origin. When movement occurs at the joint, what happens? This end will move towards the origin. So insertion moves towards the origin. And The movement occurs in different planes, and the common planes are transverse, frontal, and sagittal. You already know about these planes from your first lab. Transverse is parallel to the ground. So if you move your head right and left, that is a transverse plane movement. Make sense? Now, uh, frontal. Frontal is the plane, that divides the body or the structure into front and back, right? So tilt your head right and left towards the shoulder, that is frontal plane movement. Make sense? Sagittal, sagittal is anterior posterior line, so or plane. So sagittal divides the body into right and left, right? So the plane or line is anterior posteriorly. So if you move your head down, forward and backward, and that movement is the sagittal plane movement. Okay, so if I ask you to tilt your head forward and downwards, that is, and then go backwards, just opposite, so that plane is the sagittal plane. Okay, movement. So those are three main planes, and the movements occur mostly in those three planes. Now we'll talk about the movements occur in different types of synovial joints in the body. Most of the bones are connected by the synovial joints, and there are different types of synovial joints, and different synovial joints have different types of movements. So one type of movement is called gliding. The gliding movement occurs between the short bones and two flat surfaces. So if you these are two carpal bones in your wrist, the carpal bones, and these two short bones, when you move your wrist, move slightly here. So this is gliding type movement. So the bones slide over each other, two plane surfaces of short bones. Angular movements. There are different types of angular movements. Why these are called the angular movements? Because the size of the angle changes, okay, increases or decreases. Flexion. This is a joint, your elbow joint, okay. So if you move your forearm towards arm, this angle gets smaller, right? So that is called flexion. Now opposite of flexion is extension. So if you move your forearm away this way, the angle increases here, right? If you move this way, this angle gets smaller. So flexion and extension. Now abduction, adduction. This is your body. So these are your legs and your arms. So this is your arm, okay, shoulder, head. So now abduction. If I ask you to move your arm away from the trunk, this angle gets bigger, right? So that is abduction, moving away, sideway. Okay. And adduction is if I ask you to bring your arm closer to your trunk or body. Adduction. So adduction is bringing towards the body, and abduction is moving away from the body, sideway. Sometimes we use the term abduction. The child has been abducted from the parent, right? That means taken away or moving away. Okay, so the angle changes in your armpit. Similarly, if you move your leg this way, that is abduction, and move this way, adduction. Okay, circumduction. If I ask you to draw a circle on the board, the movement that occurs in your shoulder, that is called circumduction. Rotation. In rotation, the axis doesn't change. In circumduction, so the axis changes. But in rotation, the axis will not change. So this is a bone. This is a bone which is actually sitting around this another bone. And now if I just move this bone around this axis, this bone, that is called rotation. So when you move your head right and left, that is rotation. Uh, then, so medial and lateral rotation. If I ask you to move your head laterally, that is lateral rotation, and bring back to normal position, that is medial rotation. Special movements occur in many synovial joints. Supination, pronation. Supination is turning your palm up, that is supination. Then if I ask you to turn your palm towards the ground, downwards, that is pronation. Okay, so those are two opposite movements. Supination and pronation usually occurs in the forearm. And dorsiflexion, plantar flexion of the foot. You know that the upper surface of the foot is called the dorsal surface, and lower surface is the plantar surface. So this is the dorsal surface and this is the plantar surface. So if I ask you to move your foot up, that is dorsiflexion. This is dorsal surface, that means towards dorsal surface. And if I ask you to move your foot down, that is plantar flexion, because this is the plantar surface, sole of the foot. So up is dorsiflexion, down is plantar flexion. Inversion, eversion. If I ask you to move your big toe up, the sole of your foot or plantar surface will move inwards. So that is inversion. If I ask you to put your big toe downwards, then the plantar surface or sole will go outwards. So that is eversion. In and E. In is inwards, eversion, E outwards. Protection, retraction. Protection is pushing outwards, forwards, and retraction is pulling backwards. If I ask you to move your mandible, lower jaw, forward, that is protraction. Then if I ask you to move it backwards, that is retraction. Then another type of movement, elevation and depression. Elevation is moving up, depression is moving down. Okay, good example. If I ask you to open the mouth, the mandible moves downwards, right? So that is depression. If I ask you to close your mouth, mandible moves upwards. So that is elevation. So these are opposite, elevation, depression. Protraction, retraction are opposite to each other. Inversion, eversion are opposite to each other, right? Dorsiflexion, plantar flexion, they are opposite to each other, as well as supination and pronation, they are opposite to each other. So you need some practice yourself, clearly understand the movement. So here in next few slides I will show you different types of movements that I just explained. Here these are the carpal bones. So you see the short carpal bones are attached to each other. When you move your hand, the flat surfaces of the carpal bones move. Okay, so that is called gliding movement. Then another type of movement is here. You see the flexion extension. As I mentioned, in flexion the angle gets smaller, so and in extension the angle gets bigger. Here you can see the flexion of the head and extension of the head. And now there is another movement that is called hyperextension. So if I ask you to move your head downwards, forward and downwards, that is flexion, because the angle in your neck, front of the neck, gets smaller here. Then if I ask you, so the angle here gets smaller, right? Now if I ask you to move your head back to normal position, that is extension, because the angle goes up. Then if I ask you to do further, move your head backwards beyond the normal position, that is hyper extension. Okay, so those are three movements. In your elbow, you can only do flexion extension, you cannot do hyper extension. Again, the flexion of the upper part of the body, you can see here, extension of upper part of the body, you take it back to normal. And then hyper extension, if I ask you to do further backwards, you can do beyond normal position, so that is hyper extension. Okay, here you see the flexion extension, hyper extension. This is the flexion of your knee joint, so this angle gets smaller, right? This is extension, the angle gets bigger. Okay, and circumduction, if you draw a circle, that is circumduction. Taking your body part away is abduction, bringing back towards your body, adduction. Rotation, the axis will not change, the bone will move around the axis. So a good example, you move your head lateral and medial, so lateral rotation, medial rotation. Special movements, supination, pronation, is the palm facing up, so that is supination. And if I ask you to turn your palm downwards, that movement is called pronation. So again, if I ask you to move your palm upwards, that is supination. Okay, in pronation, you see the radius crosses over the ulna, so this is radius, this is ulna. In supine position, they are side by side, parallel, they are not crossing each other. But if I ask you to do pronation, then what happens, the radius crosses the ulna. This is the dorsal surface of the foot, so this is dorsiflexion, and this is the plantar surface or sole, so this is plantar flexion. So dorsiflexion, plantar flexion. So dorsiflexion, another way to understand is if I ask you to stand on your heel and move the front of your foot up, so that is dorsiflexion. If I ask you to stand on your toes, that is plantar flexion. Inversion, if you move your big toe up, that is inversion. If you move in opposite direction, that is eversion. Protraction and retraction. Protraction, pushing the bone outwards or forwards, that is protraction. Protruded mandible, we say, some people, you'll see the mandible is more like pushed forward, protruded mandible, so this is protraction. And if you pull back, that is retraction. Elevation, depression, depression is moving down and elevation is moving up. Now I'll talk about a couple of large synovial joints and see the structures inside and around those joints. So large synovial joints are knee joints, elbow joints, shoulder joints, hip joints. Those are large synovial joints. Let's see a knee joint. Knee joint is the most complex and the largest synovial joint of the body. Why? Because three joints together form the knee joint, and three bones are joined by the knee joint. Which three bones? The lower end of the femur, the upper end of tibia, and patella. So those are three bones joined inside the knee joint. Femur and patella join at femoropatellar joint. Patella is the kneecap, is attached to the anterior surface of the lower end of the femur, and that joint is the femoropatellar joint. It is inside the knee joint. And two other joints are lateral and medial tibiofemoral. That means between the tibia and femur. So if you see the lower end of the femur, it has two condyles. So these are condyles. And if you see the upper end of the tibia, also has two condyles. So these are two condyles of tibia, the lower bone, leg bone, and these are two condyles of the femur, the upper bone or thigh bone, and they join here and here. So these are lateral and medial tibiofemoral joint. Okay, so two tibiofemoral joint, easy, tibia and femur, and in front of your femur here you have the patella attached. So this is another joint, and that is femoropatellar joint, and all these three joints together is called the knee joint. So it is a complex and large joint. Okay, now we'll see inside and around the knee joint. Since it is a synovial joint, you already know that the ends of the bones are covered by hyaline cartilage called the articular cartilage. So here you see these are two articular cartilages, and the space or cavity is the synovial cavity that contains the synovial fluid, right? So this cavity is filled with fluid, and then you have capsule. Synovial joint must have a capsule around, and capsule has two layers. You know that, outer fibrous, inner synovial membrane. So this is the capsule, and now we'll see inside. These are two ligaments inside the knee joint. These are called cruciate ligaments, anterior and posterior cruciate ligaments. So two cruciate ligaments, and then you have bursa. A number of bursa are around the knee joint to reduce the friction between the tendons or ligaments and the bones. So this one, you see a large bursa. This is called suprapatellar bursa. Makes sense? Because this is patella, the bone. So it is above the patella. That's why it is called the suprapatellar bursa. And why this one is present here? Because you see this is the tendon of quadriceps muscle. So quadriceps tendon, and this is a big tendon, and this bursa, suprapatellar bursa, separates this tendon and the bone, femur. So when you move the joint, the friction is reduced by this bursa. this bursa is called subcutaneous. Why? Because under the skin, this is the skin here. So under the skin, that's why it is called subcutaneous. Prepatellar, before the patella. If you just see, it is under the skin, but before the patella. That's why it is called subcutaneous prepatellar bursa. So it reduces the friction between the skin and the patella. Okay. And then infrapatellar, below the patella, this is infrapatellar bursa. And this one separates the patellar ligament. This is the patellar ligament, very important ligament. You know that knee jerk testing or knee reflex is tested by hitting on this or tapping on this patellar ligament. So this bursa, infrapatellar bursa, separates the patellar ligament and the bone. Okay, so those are important bursa around the knee joint. And now you see, this structure is called the quadriceps tendon, and this structure is patellar ligament. Although they are structurally same, why this one is called a tendon, the upper one? Because it connects the muscle to the bone. So that's why it is a tendon. Why the lower one is a ligament, patellar ligament? Because it connects bone to bone, patella to the tibia. So if you see that the connective tissue structure connects muscle to bone, that is a ligament, bone to bone, muscle to bone, that is a tendon, and bone to bone is a ligament. Now we'll see the connective tissue structures around the knee joint. We already talked about the tendon of quadriceps femoris muscle above the patella. Why it is tendon? Because it connects muscle to the bone. And then below the patella you have the patellar ligament. Why it is a ligament? Because it connects bone to bone. Okay, and then just beside the patella in both sides you have the retinaculum. Structurally, retinaculum and ligament and tendon, they are all same. However, in case of retinaculum, the structure is like membrane, flat, not like a round rope like structure. It is like a flat connective tissue structure. So this is lateral side, fibular side. So this is the lateral retinaculum, and this is the medial retinaculum. Okay, in both sides of patella. And then if you go further, uh, laterally you have the collateral ligaments too. This one is attached to the tibia, that's why this is called tibial collateral. This one is fibula, attached to the fibula in fibular side, so this is fibular collateral ligament. Make sense? Okay, so tibial and fibular, and fibula is the lateral bone, tibia is the medial bone. So this is medial side and this is lateral side. Okay, so those are the connective tissue structures around the knee joint. Now the top of the tibia, upper surface of the tibia, is covered by the articular cartilage, which is a hyaline cartilage, you remember, as well as a fibrocartilaginous structure around it, and this is called meniscus. So this fibrocartilaginous structure is around the articular cartilage or hyaline cartilage, and this is called a meniscus. So there are two meniscuses in the knee joint. They are around the articular cartilage. A meniscus is formed by fibrocartilage. Okay. However, articular cartilage is hyaline cartilage. Okay. Turning of meniscus is heard very commonly. We hear the term turning of meniscus in sports. although this structure is a fibrocartilaginous structure, very tough, but also due to excessive pressure that can get torn, and that is turning of the meniscus. So here you see the turning of meniscus. This is the meniscus, and also turning of the cruciate ligament as well as turning of the tibial collateral ligament. Okay, so if something hits from the opposite side, the pressure increases in this side and will cause the turning usually in the opposite side of the pressure, opposite side of that hit. Shoulder joint is another large synovial joint. It is a ball and socket type joint. Why? Because the upper end of the humerus is like a ball, round, like this, and that articulates with the glenoid cavity of the scapula, which is a shallow socket. Okay, so this is a ball and socket type joint, shoulder joint. So this is the head of the humerus, and this is the glenoid cavity of the scapula. Okay, and around the shoulder joint there are three sets of ligaments. We'll see that soon. So this is the head of the humerus, and this is the articular cartilage, since it is a synovial joint, right? And this is the head, this is the glenoid cavity of the scapula. So you see, this is the joint, and this is the gap. Synovial cavity contains the fluid, synovial fluid. Okay, and also you have the capsule around the joint. So this is a typical synovial joint, and this is a bursa under the coracoacromial ligament, and this bursa is called subacromial bursa. You remember in the scapula there is a process called the acromion. So this is under the acromion, that's why it is called subacromial bursa. When you move your shoulder, when you move your arm, the head of the humerus moves, and this bursa rotates or rolls between the ligament and the head of the humerus. Here you see subacromial bursa, the same one I showed you. This is the coracoacromial ligament. Why this is called coracoacromial ligament? Around the shoulder joint, this is the coracoid process of the scapula, and this is the acromion of the scapula. So very simple, coracoacromial ligament. And this is another ligament. This is called coracohumeral. You see, this is the coracoid process, so this end is attached to the coracoid, and this is the humerus, the bone, so coracohumeral ligament. Makes sense. There are three glenohumeral ligament. So this is the humerus, and this is the glenoid cavity inside these ligaments. So these three ligaments here connect the humerus and glenoid. So glenohumeral. How many? Three. Glenoid to humerus, glenohumeral. And so those are the ligaments around the shoulder joint to keep the shoulder joint more stable. And there is another bursa that is called subscapular bursa, the inner side of the scapula. Okay, so those are the things you need to know from the joints. First, we talked about the classification of the joints. We classify the joints in two ways: by looking at the function, that means how much movement occurs, and also by looking at the structures, which structures are present in the joints. And then we talked about the properties of a typical synovial joints. We talked about the movements, different types of movements that occur in the synovial joints, And then we talked about two different types of synovial joints, the two different large synovial joints. We talked about the knee joint and shoulder joint.